Welcome to Mount Sinai Live. We stream smart healthcare information that's simple to understand so you can improve your health. Hi, I'm Dr. Jimmy McKay, and I'm your host. Today, we're talking about mental health content on social media and its effects. Remember, audience, if you have questions or comments during the live stream, feel free to drop them in the comments below on whatever platform you're watching from. Now, to educate us about mental health content on social media today is licensed clinical psychologist with a specialty in child and adolescent psychology and an assistant professor in the Department of Psychiatry here at Mount Sinai, Dr. Billy Katz. Dr. Katz, welcome to Mount Sinai Live.
Thank you so much for having me.
All right, let's jump right into this. We're talking about mental health content on social media. Let's talk about risks and benefits of mental health content on social media. What are they?
Yeah, I think the overwhelming benefit is that having more mental health content on social media is reducing stigma. We're more likely to talk about it. We're more likely to share information about it. And as we see content creators, organizations, individuals being more upfront about mental health difficulties, it empowers us to be more upfront with the people in our lives about what we're struggling with.
Yeah.
Some of the downsides, right? Thinking about some of those risks is that there's so much misinformation out there. And there is no one size fits all when it comes to mental health or mental health diagnoses. So, a really big thing these days, especially on platforms like TikTok, is all about how to go about getting diagnoses for different mental health conditions. And that can be really dangerous if you're trying to do that via an app, via social media, doing your own sort of me search, because as I said before, it's not one size fits all. And oftentimes what looks like a certain diagnosis for one person could be very different for another, or it could be something else entirely, such as like a physical or medical health condition.
So definitely reducing stigma, making it more well-known, more talked about is kind of reducing that stigma, but also be careful where you're getting your information from. Of course, if you want to go further, you want to get it from licensed healthcare provider.
Exactly. I always think that, having this content out there is a great place to start the conversation. I love when my own patients are coming into session saying, I saw this video, I saw this post, can we talk about it? To me, that's like best case scenario. It can feel a little bit more dangerous if someone's just consuming this information and not sharing, their thoughts, their comments, their concerns with a licensed professional.
So since this comes up in your clinical practice, why do you think mental health content in particular is becoming more and more popular on social media across platforms?
Yeah, so I think this is a combination of a couple of different factors. I think first is we've seen the rise of mental health content on social media really coinciding with the COVID-19 pandemic, where there, of course, has been more focus on what, people in the field and, leaders have termed this mental health crisis. And so we are seeing that there are more individuals, particularly children, adolescents, that are focused more on their mental health. Years and years ago, right, mental health and therapy used to be something no one spoke about. If you were seeking out, you were receiving therapy, you were receiving treatment of any kind, it was secretive, it was shameful. We have swung to the total opposite side of the spectrum more recently, and it's buzzy to talk about therapy. And as, a licensed provider, I think this is great. And it's so like mental health is cool these days. And so I think that we're seeing more and more content. We're seeing that influencers and content creators want to be viewed as real human beings. And part of being a real human being is being open about the good, the bad.
Yeah, mental health is cool. You heard it here first.
Yeah, there we go.
Self-care. Hashtag self-care. So you brought up some of them, but let's talk about the risks of self-diagnosis. I'm going to guess one would be worrying about something that actually isn't there.
Yeah, so it would be worrying about something that's not there, overlooking, something that might be there, right? There's a lot of mental health conditions that also share symptoms with serious medical problems. So for example, someone can see a post about anxiety and think that they're suffering from anxiety or panic attacks, when in reality, they have an underlying, heart or respiratory condition. And so that can be really dangerous because the treatments for those and the response time needed to really accurately intervene are going to be drastically different if we're classifying ourselves as having anxiety or panic versus an actual medical, an actual medical problem.
Okay. So if they're at this step, right?
Mm-hmm.
What do you suggest people do next if someone thinks they have a mental illness based on some social media content, maybe on some initial self-diagnosis? What's your suggestion?
Yeah, so I think this really depends on how easy it is to access licensed professional help. And so for someone that has access to a licensed mental health professional, this is always, I think, it's best to seek out those services. There are a lot of community-based clinics and hospitals, especially at Mount Sinai, right, where we have walk-in sort of crisis services. You can always walk into the emergency room if you feel like there's, an emergency that really can't wait for you to get that initial intake appointment. And there's crisis support. So there's a lot of city and community-based resources for individuals. I also always say, right, if we're in an area where we don't have access to licensed mental health professionals, your primary care doctor is the absolute first line of defense, right? Internal medicine primary care providers are all trained in how to effectively, right, diagnose and educate about a range of mental health issues and help with that referral process.
How do you suggest if someone was going from zero to consuming all this content that we mentioned that's out there, how would you tell people to approach it? What to keep in mind when seeing it? You've touched on a few of those things, but I want to make sure we didn't miss any of them.
Yeah, I think we want to have this dose of healthy skepticism, right? We want to say, as you said before, buyer beware, right? Yeah, this could be accurate. It also may not be. Maybe parts of this fit. Maybe we're not seeing the whole picture. And so I think that we can be thoughtful and we want to be skeptical at the same time. And I always recommend that we seek out professional resources, right? And these can include online. There's some great resources. The Mount Sinai website, for example, has, information listed out by diagnosis. There's professional organizations such as the American Psychological Association, the National Alliance on Mental Illness, that have fact sheets and other information about a range of diagnoses and treatment options. So I always say, if we're going to stick to sort of that broad research on the internet, sort of gearing more towards these professional accredited organizations are going to provide much more authenticated information than we're going to see on social media.
Healthy skeptical. I like that. From your point of view, it's be a healthy skeptic. Any general tips on maintaining mental health while using social media, just in general?
Yeah, I think social media is a blessing and a curse, and I experience this firsthand all the time. It's really to figure out, how is consuming content on social media impacting me, the way that I think and I feel and the way I behave based on what I'm seeing, right? I have observed in myself personally, if I am stressed or anxious about something, social media tends to be my biggest enemy, right? Versus if I'm just sort of chilling and relaxing and mindlessly scrolling, social media can be really entertaining. So I think it's to be a little bit more mindful, a little bit more aware of the impact that social media content of mental health or, otherwise general content, the impact that it's having on us and how it's making us feel.
We're feeling very, very meta as we broadcast on Facebook, which is owned by Meta, as we share good mental health practices for consuming content on social media. Dr. Billy Katz, clinical psychologist here at Mount Sinai. Thanks so much for the insight. You can find us at Mount Sinai NYC on all major social platforms. This has been another Mount Sinai Live broadcast. We stream smart healthcare information that's simple to understand so you can improve your health. I'm physical therapist Dr. Jimmy McKay. Thanks for watching.